10 warning signs of heart attack a week before it happens. Heart attacks, or myocardial infarctions, are often seen as sudden and unexpected events. However, in many cases, the body may give subtle warnings days or even a week in advance that a heart attack is imminent. Recognizing these early signs can be crucial for seeking timely medical intervention, potentially saving a life. Understanding the common symptoms that may appear a week before a heart attack provides individuals with the ability to respond proactively. While these signs are often understated and may be confused with other less serious conditions, awareness of the following symptoms is vital. 1. Chest discomfort or pain. One of the most common early signs of a heart attack is chest pain or discomfort, known as angina. This sensation may not always be severe. Instead, it can feel like pressure, tightness, or a squeezing sensation in the center or left side of the chest. Angina occurs when the heart muscle isn't getting enough oxygen-rich blood, often due to narrowed or blocked coronary arteries. This discomfort can last for a few minutes, come and go, and may be triggered by physical exertion or stress. It is important to note that angina can vary in intensity and may be mistaken for indigestion or heartburn. If chest discomfort persists or is accompanied by other symptoms, it should not be ignored, as it could be an early indication of an impending heart attack. Chest discomfort is perhaps the most well-known symptom of an impending heart attack, but it's important to note that it doesn't always present in the same way for everyone. The discomfort may feel like a tightness, pressure, or squeezing sensation in the center of the chest. It might last for a few minutes or come and go. The pain is often mild and can easily be mistaken for indigestion or heartburn. In some cases, it may radiate to the arms, shoulders, or back. Recognizing chest discomfort as a potential heart attack warning is crucial, especially when it is accompanied by other symptoms like shortness of breath or nausea. If the discomfort persists for more than a few minutes or intensifies, immediate medical attention should be sought. 2. Fatigue. Unexplained fatigue is another common warning sign that can manifest a week before a heart attack. Many individuals, especially women, report feeling unusually tired even after performing simple tasks that normally wouldn't leave them exhausted. This kind of fatigue is different from regular tiredness, as it often persists despite getting enough rest. The reason behind this fatigue is that the heart is working harder to pump blood through blocked or narrowed arteries, which can cause a lack of oxygen in the body's tissues. If someone is feeling fatigued without a clear reason, and this fatigue is accompanied by other heart attack symptoms, it is crucial to take this seriously. Fatigue is often overlooked as a symptom of an impending heart attack, particularly because it can be associated with a variety of conditions. However, when someone experiences extreme or unusual fatigue without an obvious cause, it may be an early warning sign that the heart is struggling. This type of fatigue is different from regular tiredness. It often persists despite adequate rest and sleep. Women are more likely than men to report fatigue as a precursor to a heart attack. The reason for this fatigue is that the heart, which is not receiving enough oxygen due to blocked arteries, has to work harder to maintain blood flow. As a result, the body becomes exhausted even with minimal exertion. Recognizing unexplained fatigue and seeking medical advice can help prevent the situation from worsening. 3. Shortness of breath. Shortness of breath can occur even when the individual is at rest, and it may appear without any prior warning. This symptom can be particularly concerning when paired with chest discomfort or fatigue. The lack of oxygen flow to the heart muscle means the lungs are not receiving adequate oxygen either, making breathing more difficult. Difficulty in breathing, especially after light physical activity or while lying down, can indicate that the heart is not functioning efficiently, possibly due to a buildup of fluid in the lungs, a condition known as pulmonary edema. If shortness of breath occurs suddenly and persists, it may be a precursor to a heart attack and should prompt immediate medical attention. Shortness of breath, especially when it occurs with minimal exertion or at rest, is a significant early warning sign of heart trouble. This symptom indicates that the heart is not pumping effectively, leading to reduced oxygen delivery to the body's tissues. When shortness of breath is experienced alongside chest discomfort or fatigue, it's a strong indicator that a heart attack may be imminent. This symptom can be particularly concerning if it happens suddenly, or if it worsens over a short period of time. Sometimes, shortness of breath occurs while lying down or sleeping, a condition known as orthopnea. If you notice these symptoms, especially in combination with others like chest pain or dizziness, it is important to consult a doctor immediately. 4. Lightheadedness or dizziness. Feeling lightheaded or dizzy can be a result of reduced blood flow to the brain, which may be caused by a weakened heart struggling to pump blood efficiently. Dizziness may accompany other symptoms like chest pain, shortness of breath, or even nausea. While occasional dizziness can have various causes, including dehydration or low blood sugar, when it occurs alongside other potential heart attack symptoms, it becomes a red flag that should not be ignored. If someone feels faint or dizzy, especially without a clear reason, it is essential to seek medical evaluation to rule out a potential heart attack. Dizziness or lightheadedness is another subtle sign that can precede a heart attack by a week. This occurs when the heart's ability to pump blood is compromised, leading to decreased blood flow to the brain. While occasional dizziness can result from dehydration or a drop in blood pressure, persistent or severe dizziness, especially when accompanied by other symptoms like chest pain or shortness of breath, can be a sign of a serious cardiovascular issue. If you experience unexplained dizziness, it is important to rule out heart-related causes, as this symptom may be an early warning of a heart attack. 5. Nausea or indigestion. Although less commonly associated with heart attacks, nausea, indigestion, or even vomiting can occur, particularly in women. These symptoms are often mistaken for gastrointestinal issues, but they may be linked to the heart. This is because when a heart attack is imminent, the body's response to reduced blood flow can affect the digestive system. Some individuals report feeling an uncomfortable fullness or bloating in the upper abdomen, similar to what one might experience after eating a large meal. Persistent nausea or indigestion that does not go away with standard treatments could be a sign of something more serious, such as a heart attack. Nausea, indigestion, or even vomiting are less commonly recognized symptoms of a heart attack, but they can occur, especially in women. Many people mistakenly attribute these symptoms to gastrointestinal problems, especially if they've recently eaten. However, when nausea is accompanied by other signs like chest discomfort, it should not be taken lightly. The connection between the digestive system and heart health lies in the fact that reduced oxygen flow can affect multiple systems in the body. If nausea persists or if it's combined with other heart attack symptoms, seeking medical attention is important for early diagnosis. 6. Pain in other areas of the body. Heart attack pain is not always confined to the chest. It can radiate to other areas of the body, particularly the arms, back, neck, jaw, or stomach. For some individuals, this pain might feel like a dull ache or sharp stabbing sensation that comes and goes. Often, the pain will start in the chest and then spread, but in some cases, the pain might be more prominent in other parts of the body. For example, some individuals may experience intense pain in the left arm or jaw, which can lead them to overlook the possibility of a heart attack. Recognizing this as a potential sign of heart distress is critical for timely action. Heart attack pain doesn't always stay confined to the chest. In many cases, it radiates to other areas of the body, such as the arms, shoulders, neck, jaw, or back. Some people experience pain that starts in the chest and then spreads to these other areas, while others may feel pain primarily in one of these regions. For instance, pain in the left arm or jaw is a well-known sign of a heart attack. However, many individuals may overlook this symptom or misinterpret it as a muscle strain. The key is to recognize when this pain is unusual or when it's associated with other heart attack warning signs, such as shortness of breath or fatigue. 7. Cold sweats. Breaking out in a cold sweat is another sign that a heart attack could be imminent. This type of sweating is often described as feeling clammy or excessively sweaty without any obvious cause, such as physical exertion or being in a hot environment. Cold sweats may occur suddenly and can be a reaction to stress or pain caused by reduced blood flow to the heart. If this symptom arises alongside chest pain or other discomforts, it is essential to seek medical help immediately. Breaking out in a cold sweat or experiencing clammy skin is another sign that a heart attack may be imminent. This type of sweating often occurs suddenly and without any obvious cause, such as physical exertion or heat. Cold sweats may happen due to the body's stress response, as it reacts to the heart's reduced function. This symptom, especially when accompanied by others like chest discomfort, nausea, or dizziness, should not be ignored. Seeking medical help immediately is crucial, as cold sweats are a common sign of a heart attack. 8. Anxiety or a sense of impending doom. Anxiety is a symptom that may appear before a heart attack, particularly in those who are more prone to panic attacks or high levels of stress. However, this type of anxiety is often accompanied by other heart attack symptoms, such as chest pain, shortness of breath, or dizziness. Many individuals describe a sense of impending doom, an unexplainable feeling that something terrible is about to happen. This sense may be linked to the body's response to reduced oxygen flow to vital organs. If anxiety arises with no clear reason and is paired with other physical symptoms, it is worth considering the possibility of a heart issue. Many individuals report feeling unusually anxious or having a sense of impending doom in the days leading up to a heart attack. This sensation, while difficult to quantify, is often described as a feeling that something bad is about to happen. Anxiety can also exacerbate other symptoms, like chest pain or shortness of breath. It's important to differentiate between general anxiety and anxiety that's accompanied by physical symptoms, especially in those with a history of heart disease or other risk factors. 9. Swelling in the legs, ankles, or feet. Swelling, known as edema, can occur when the heart is not pumping blood effectively. This causes fluid to build up in the legs, ankles, or feet. While swelling in these areas can be caused by many factors, including sitting or standing for long periods, it can also be a sign of heart failure, which may precede a heart attack. If the swelling is persistent and accompanied by other symptoms, such as shortness of breath or fatigue, it is essential to consult a doctor. Swelling in the lower extremities, known as edema, can occur when the heart is not pumping blood efficiently. This causes fluid to build up, particularly in the legs, ankles, or feet. While edema can have many causes, including prolonged sitting or standing, it is a symptom of heart failure, which can precede a heart attack. If the swelling is accompanied by other symptoms like shortness of breath or fatigue, it may be a sign that the heart is under distress. 10. Sleep disturbances. Changes in sleep patterns, such as difficulty falling asleep or staying asleep, may be an early warning sign of a heart attack. Some people report experiencing insomnia or restlessness in the days leading up to a heart attack, feeling unusually anxious or unable to relax. In some cases, this symptom may be accompanied by physical sensations, such as chest discomfort or shortness of breath, that make it hard to sleep. If these disturbances are new and unexplained, they could be indicative of an underlying heart problem. Changes in sleep patterns, such as difficulty falling asleep or staying asleep, may also be a sign that a heart attack is approaching. Some individuals report waking up in the middle of the night with a sense of unease, while others experience trouble getting comfortable due to chest pain or shortness of breath. While sleep disturbances can be attributed to many causes, if they occur alongside other heart-related symptoms, it's important to consult a healthcare provider.